Really excited that you guys showed us today. I met Chris a couple weeks ago. I had a doctor's office ask me a lot about advanced directives, and I know a bit, but they were asking me a lot of questions. I'm like, you know what? When I don't know something, I rather go to the direct source. And so I reached out to Chris and said, hey, what would you think about coming up to present? Because I know a lot of social workers and nurses and medical professionals do help with advanced directives. And Chris was gracious. He came from Boise this morning. He had like a 5-hour trip this morning, so that's the dedication there. But I'm so excited because I think Chris is an awesome resource. He's obviously going to talk a little bit about advanced directives. You guys all probably know a bit, but he'll also talk about specifics about the registry and some different things like that. And also he'll have opportunity for Q&A. But yeah, Chris, he's an Army veteran, appreciating his service. He is the director of the Idaho Healthcare Registry. And I'm going to turn the time over to him. With this permission, we're going to record this, so if you feel it's helpful, we can certainly get to other people that couldn't make it. The idea is that we're all on the same page with advanced directives to see how the registry works. And just appreciate all you guys do to help seniors. I know most of you work very much hands-on with seniors. So I'm going to turn the time over to Chris.
Angie, I was just saying, my last presentation, there was supposed to be 40 or so people, and there was one. So, but that's all right. That's one more person that's educated about advanced care planning and the registries. It's still, at the end of the day, I know these documents are important. I've gone through experiences with them, both personal and professionally, so I'm a good believer in them. My name is Chris Irizarry. I'm the program manager. I've been with the department for about 4 years. My first day, they handed me the registry and said it just came over from a Secretary of State. We have these requirements, make it happen. So it was a combination of learning how to be a program manager, coming from the military where I could just bark orders at people, and learning about advanced care planning. So I have, I don't have her name on here. We have a temporary employee that does help us create accounts and upload documents. But my primary specialist here is Grace. She moves between North Idaho and the Boise area and tries to do presentations as she can. So yeah, as far as the registry goes, there's no test, but I just like to share the registry falls under the Office of Healthcare Policy Initiatives, which is under the Bureau of Healthcare Access, which is in the Division of Public Health, which is one of the 6 divisions of Department of Health and Welfare. Again, no test on the hierarchy. Oh. All right. So again, welcome everybody. This really is fantastic turnout. I know at the chance that there was going to be a few people here, but I thought maybe a few, not this many. So it's great to see that people either care for themselves and their patients or family members, whatever it may be. So by raise of hands, like how many people agree when I say life could be unexpected events can take place? It's uncertain. We just don't know. Yeah, right? Like stating the obvious. So before you go camping, what do? You prepare. You whatever, get your sleeping bags ready. Some people may have a food storage. You prepared for a disaster of some kind. It's all about preparedness. You prepared it on a road trip, go to Disneyland, whatever it may be. Nobody wants to prepare for their end of life. Why not? It's just something a lot of people like to talk about. And that's one of the things that I like to bring up is making this more of a routine discussion with family members. Try not to be scared about it, especially around holidays when families come together. It's definitely an opportunity to meet with them and talk to them about these things. Sure. So, as Chance mentioned, we'll talk a little bit about advanced care planning. I'm sure some of you are familiar with that already. The advanced directives, the post form, the physician order for scope of treatment, and then the HealthcareDirective registry as a tool for advanced care planning, and then additional resources that are available. All right, so advanced care planning. Anybody want to take a stab at it? Share what advanced care finding is to them? And takers? Oh, I see.
I really like advanced directives because I think it's one of the most selfless things you can do because it puts forth what you want as far as who you trust if for any reason you will become unable to advocate for yourself. And it also, it takes some of the accountability off people to having to make hard decisions as far as what you would want, as far as even who makes those decisions.
Oh, for sure. And you can actually come off that finish stuff. I see you've got it. You made it very. I like to say break it down even simpler. In the military, they said break it down Barney style. Anybody know Barney Fife? Not a real smart guy. So you have to make it real simple. And so it's just you're planning for something in advance that could or probably will happen at some point in time. And it really is just that. You're talking about, as you said, what type of treatment do you want in an emergency situation? What are you okay, as far as your lifestyle, your goals, stuff like that? Oh, that's cool. And just a couple of the steps, like I said, evaluate your quality of life when you're looking at advanced directives. And if you're helping a patient, that quality of life, and are you okay with, if something happens to you, you okay being stuck in there? Because whatever took place has left you that way. You're immobile, maybe you're left in a vegetative state, whatever it may be. If you're thinking about what life really leads to you. And then think of possible and realistic scenarios. Scenarios like car accidents, if you have a chronic illness, what that's going to look like. And types of medical situations that would occur from those. And then consider choices that align with your values and beliefs. And somebody asked me about that. I said, it kind of gets a little into religion, right? I know there's some religions that are not okay with receiving blood products from other people or receiving medical care at all. So again, something to think about. And then I put into planning worksheet. Department of Health and Welfare has created a worksheet that is kind of scenario based. So it really tries to break it down. In a situation like this, what would you like? So the planning worksheet really helps out. It's not a part of the advanced directive. It just helps you come to some of those conclusions. And then identifying your healthcare agents. So you know what you want. You just need to make sure that those agents not only understand what you want as well, but are willing to stand up and ensure that you're receiving the treatment that you want it. And then most importantly, if you're documenting it, it's great up in your head, but it's even better on paper. All right. So does everybody know what an advanced directive is? Lots of nods. No,
But that's just most do.
yeah, and I assume this much, but maybe if there's one or two that doesn't. Tonight was
Like you just say, it's when you direct in advance.
yes. Like you want that? No, that's a great. Like I said, I like breaking things down as simple as it can be. Yeah, it's your living will. You're saying this is what I want in this situation. Your durable power of attorney for healthcare, which I stress because some people take can go do big stuff and buy houses and whatever else on my parents' name. It's for healthcare. So those two documents combined make the difference. And then, so we have, this is just the department's version of the advanced directive, just that front page. So we offer this on our website. You can also, and we'll get into this, but on the registry itself, you can create an account or have an account created for you. And then you can answer a few questions and then it generates this document. It doesn't have to be this one. We talked a little bit ago. There's one called 5 Wishes. There's older ones called Honoring Choices-Idaho. Doesn't matter. You can write it on a bar napkin and sign it, and I'll scan it and upload it. It's a legal document. Right. So the post form, a little bit different. And so talking about this one, this is not available on our website, and it's primarily because a lot of people don't know what it is. They just assume, oh, it's there, I have to fill it out. They never get the doctor's signature, so it's not valid anyways. Typically, the post form is reserved for those that are a little bit closer to their end of life, whether it be natural causes or typically a chronic illness of some type. Now, that's not to say if any of you have post form that you're going to be leaving us anytime soon. That's just, again, generally reserved for that. And that's because the likelihood of an event taking place at your home is higher because of those chronic illnesses or diseases than it would at a facility. Call that. So I kind of always wondered why you needed post to really love the place. Perfect. And so that's what we'll talk about here. And I know it looks fancy side by side, but I try to, again, break it down easy. So if you have an advanced directive that says, do not resuscitate, leave me alone, don't touch me, and a paramedic shows up to the home, that paramedic will read that directive and he's going to resuscitate. He's not a doctor. He can't, or she has to try to sustain that patient, stabilize that patient, and get them transported. Once they're at the facility is when really that advanced directive takes place. So the post form, same scenario, paramedics arrived and they have a post form that is signed by a doctor, then you will adhere to what that post form said. So if it says do not resuscitate, then they'll go by what the post form says. So I like to say,
Chris, you're clarifying, say, even if it says do not resuscitate on the advanced directive, they will not follow that because it's not signed by a doctor. It's not a post form.
correct.
So that do one thing. And most of the people in this room deal with chronically ill patients. Definitely want a post form for sure.
Right. Yeah, and that's why I like to say that the post form is for at home, and advanced directive is really when you're at a facility. Because at that care facility, you're going to have those doctors that can make those decisions.
So when you say facility, you're saying hospital.
Yes.
My gosh, yes, you're not talking well, a skill facility here.
Yeah.
Still, that skill says, and we have both.
Yeah, I was going to say like a hospice or a long-term living facility. I know a lot of them require a post form of some kind. So yeah, that's kind of the basics of the post versus advanced directive. Personally, I would like to have both. I don't think there's anything wrong with that. There's nothing that says you can't have that. You can, if you are interested in one and you're perfectly healthy, just shoot us an email. We provide them on request. And again, that's primarily because a lot of people don't know what they're filling out, and then they don't fill it out correctly. And a lot of times we were seeing they would contradict one another. So their directive says, don't touch me. Their post says, do touch me. So yeah, it sort of helps clarify that.
Chris, can I interject?
Absolutely.
Correct me if I'm wrong, but a post does not dictate who your healthcare agent is. I haven't seen a spot for that. I could be wrong. An advanced directive does, correct?
Right. So on the back of, and that's really kind of there's again a lot of different versions of the post form. The only difference on the one that the department has completed is there's contact information. There's information, for that a hospice can fill out even, or at a facility of some type. It's just helpful information, but right, it's not designating the healthcare agent. It's just saying this is what I want, regardless of what anybody else says.
And doesn't the advanced directive also kind of go through scenarios of, different things you were mentioning at the last presentation about the music, and we'll speak about.
Yeah. So again, I know it's just the front page of the advanced directive form, but ours is 6 pages, and on the 5th page, there's a blank area that allows you to put in. It's basically an opportunity to provide a note to your medical team or to your family, whatever it may be. And what Chance is referring to is I've seen some that say, I want to be in my favorite slippers with this classical music or rock music playing in the background. Whether or not they can, that patient can hear it or not, that's just, again, something that they would like. We have people that put information, again, a note to the family about their burial. This is the church that I have already set stuff up with, or whatever you would like to put in there. It's a free for all at that point. And then you can do other things where you can specify about treatment when it comes to resuscitation, right? Maybe you're okay getting a CPR, but you don't want a ventilator, or vice versa. So you can, and again, you can add in our stuff about blood products. Yes.
Well, I was just wondering, so when people are sending in their advanced directives, is it like sending also their entire will? So it's listed somewhere, and that way if their house were to burn up and so were their will, and they forgot, a lot of our people, they forget what lawyer office they used 30 years ago kind of thing. Is that what they send you, or is it only referring like the medical stuff?
Yeah. So we actually sometimes receive some of the trust information or last will and testament, and fortunately we have to send it back. We just I feel like personally we need like an attorney on staff to be able to review that stuff or something. But yeah, we just manage the living will and durable power of attorney as it pertains to healthcare. Yeah. So you might, on that same note, if you look at the Secretary of State's website where the registry originally lived, there is a spot there that you can register your living will, or excuse me, your last will and testament. However, it is very stagnant. It's going to be, you're just giving them a copy and it goes nowhere. So not to be confused with this. So I wish they would get rid of it. I don't think anybody uses it anyways. It's like $11. It's the same as just handing it to a peer. So. All right, so the registry itself has actually been around since 2007. Prior to this, has anybody heard of the registry? And it won't hurt my heart if you haven't.
It's part of why you're here, right?
Exactly. I had no idea. I didn't even know what an advanced directive was. In the military, they decided what would happen with me. So, yeah, back in 2007 is when the registry started at the Secretary of State's website, or excuse me, office. And they had anybody that registered that were given a card that had a username and a password. And that was the only way that documents could get retrieved. If you didn't have that card, it was kind of lost. And a situation took place with a legislator, and it took that situation to happen for them to realize that they need something updated. And that's where the registry was transferred over to the Department of Health and Welfare. So now it's a web-based platform accessible to both healthcare providers and the patient themselves 24 hours a day. You can create an advanced directive on the account itself, or you can scan a copy, upload it yourself. You can send it to us. We'll upload it for you, whatever it may be. So there's a lot of different options when it comes to that. I was talking a little bit earlier about kind of that process we had. After we sort of trimmed the fat of, I shouldn't say that. We trimmed some of the names off of the list that we had assumed that did since departed. There was a date of birth in there that was 1898. So we figured, probably on this day on, we'll just let those go. The registry had never been updated, and that's something now that we do every 2 years. But we had, at the end of the day, about 43,000 documents that came over, and I only mention that because I'll show you some numbers now, just after a couple of years. And so if anybody talks to you about having this card with a username and a password, just let them know, like, it's not going to do anything anymore for you. It's not to say that their document isn't accessible, because we automatically created an account for them. so healthcare providers can still view those documents. So this is just a kind of a snapshot. I'm not a health and welfare contracted with VitaCare. VitaCare is a couple of physicians that they really focus on palliative care, and to do that, they wanted to create a registry, and then other states started to adopt that, and that's where we had them create it's as simple as you can get, this registry that's from the patient's perspective. That's the login page that they would see. They have a username, which is typically their email address or phone number. And then so you log in, and again, there's only so many options in there. So for those that are maybe not so tech savvy, you can only click so many lines, which does make it nice. And something that's continually doing is adding healthcare professionals to the registry, giving them access. So the same access that I have. So basically, you're able to go in there, search for a patient, and you can view their directive, or you can create an account for them, upload those documents, and again, we'll get into that a little bit more, that healthcare access. So the other form you might see on our website is just the registration form. It's just capturing information that we need to create the account. We receive these all the time. We don't even care if they're soggy. We just need that information so we can create the account. And then we've updated a little bit, and maybe if you're currently using one at your facility, it's going to look a little bit different. Okay, so it's not a perfect system. And what I mean by that is, for a hospital to access those documents, that individual needs a login. So we give that login to an individual at that healthcare facility, and it's great. Now they have access to be able to search for patients, view their documents, stuff like that. If that person is not at work that day, nobody at that facility access those documents. So that's kind of where we have a little bit of a cap. We try to get as many people as we can for each organization an account, and that way they're able to search, create accounts, and view the advanced directives. Will you anybody's? I'll say log in. Yes. So and kind of to go into that a little bit, they're also healthcare professionals are bound by HIPAA laws, so they're not out selling stuff or selling this information to third-party people. We also have law offices that have access to this, that do estate planning, and they're able to just create the account, upload the documents. We have them sign non-disclosure agreements, and again, just to ensure that patient information is protected. And we have a resource page, and it provides some different flyers, worksheets. There's different things from like medical terminology. What is CPR? And then it has the instructions on what a primary healthcare agent is, what some of their responsibilities are, what that actually means, some of the situations that involve dementia, Alzheimer's, and EV COVID.
Chris, if I can interject.
Yes.
So I went through that. I think you have about 10 different worksheets. I know medical, all of us are pretty busy. Sometimes we have more time than others. I recommend having them review those things before talking to you, so you're not spending 2 hours educating on things that are already on the sheet. Holy crap, I've gone through it. It's very helpful. I just highlighted it, but those things are readily available to share with patients and stuff for educational purposes, right?
Oh, for sure. So at your facility, you can say, maybe somebody doesn't know what an advanced directive is. There's a sheet that explains very plainly what an advanced directive is, kind of what its purpose is, and then again, might have some of the terminology they may not be familiar with, provides that. So there's lots of different tools on there that you can take a look at, provide them to your patients ahead of time. You can provide them a copy of the directive before a wellness visit, and that way, you know, if anything, they just have a couple of questions here or there. You're not explaining everything step by step. And then on there also is just a quick shot to the registry. So yeah.
So I do have a question where sometimes people will name a power of attorney and then they decide they no longer want that person as their representative. If they submitted that to the registry and then say a year later decided I no longer want this person, they do a new one and they submit that to your registry, do they need to provide like a revocation form, or do you just go off of whatever's the newest form?
Right, we go by the date. So as soon as we upload it, the system actually will void and mark it void as a prior version, and then it takes that current version and marks it as current. So there's no confusion as to which one should be which. Yeah. All right. So everybody loves I in this case. Hi, Char. Sorry, Dad joke. But yeah, like I mentioned before, 43,000 documents. In between myself and another, we've been able to grow the registry just by providing the education. We've done some things that haven't worked, like put a sign on a bus. It's just too much information to put on moving vehicle. To just putting ads in the newspaper. So we're hoping to have a little more information utilizing a media contract that we have. But yeah, primarily you can see like there's obviously a lot more advanced directives than there are BOST ones, which is kind of to be expected. I still share the addendums, even though they're not true addendums. It's just one of the law offices likes to put the registration form in the addendum column. That's it. So just to show how it, you know, all the percentages actually add up, I still share it. And so we have a public information plan to get out and promote the registry and advanced care planning. We have partnerships both internally and externally with specifically that was the first one I made was our Alzheimer's and dementia-related diseases program. We do a lot of work together. We just completed a symposium with the YMCA and providing education, and it can be just on request. More than happy to come out and speak with anybody, whether it's one person or a room full of people. And I can do webinars too, so whatever's easiest. And we're hoping to start a little bit of social media and then begin utilizing local newspapers. Still put buses on there because I did it and it was a mistake, but I've passed on to it.
Chris, I'm interjecting again. Yes, I love that. I know, like, doctor's office before that we were at. If they have a specific, unique question regarding, because there are some situations that are a little tricky, can they email you directly and say, hey, I'd like some clarification? I know you have some higher ups in the nursing and legal realm. Would that be appropriate to, for example, like, hey, I'm having a hard time with my login, and hey, by the way, this is a tricky situation. I want some guidance. Can they?
Absolutely. So, and it's not just, I don't know everything. Aside from what I tell my kids, I still am stumped every now and again with a question. Not that long ago, we talked a little bit about it where I was asked, well, if something happens to me in Idaho, how do I get transported to Oregon where I can be euthanized? And I thought, well, there's one for you. Fortunately, I do work closely with an estate attorney who helped us with some of the forums, and then an MSN at Solutions, who's also part of the National Post Association. And between those two and then a few others, we're able to answer whatever questions might be out there and different situations, scenarios, but like that. So yeah, any questions that you might have, you can email it to myself or to our general inbox, which comes to me anyways. So one way or another, you're stuck with me. right. So projects. Again, I talked a little bit about some of the gaps, right, between hospitals reaching the documents in the registry. And so I go straight to me, it's the bib, is integrating a hospital's electronic medical record to the registry. And in Utah, Intermountain is doing that right now. I kind of say they're at anything. But essentially, if they upload a post form or an advance directive to a patient's EMR, it's automatically transferred over, account is created to the registry. Vice versa, if an account is created in the registry and it picks it up on there, it's moved over to a patient's EMR. So that one has been a little more difficult because it's one person going to, I think, St. Luke's or St. Alphonsus saying, hey, let's do this. And and then the finances, who is going to foot bill for this? We actually have worked with a few insurance companies that are more than happy to pay for some of it if we can figure out the IT portion of it. Because at the end of the day, an advanced directive helps insurance companies as well. I think that's all I got. I'm sure I missed a few things, but more than happy to answer questions you might have. I'll skip over and put up our information here.
And you have a card you can give them.
Yes, absolutely. I have some cards, some brochures. If anybody has any questions or anything, I have a fancy notebook that you can write your name in, and I can shoot you anything via email. I also brought advanced directives that have the registration form and the directive itself. I did bring those forms.
So does anybody have some tough questions for Chris? I know some have been asked throughout, but
Yeah, it's a comment question. And this has come up a couple times. I'm a hospital social worker, and we've had a couple people that the person wants them to be their medical power of attorney, and this is a siblings, and the sister's like, yeah, I'll be his power of attorney, but I don't want to be financially responsible for a funeral or anything like that. And I had this come up twice recently. I'm like, well, doesn't necessarily make you financially responsible, but I think that's the fear of a lot of people saying, I don't want that because they don't have the money. I don't have the money either.
Right. No, exactly. And so in the directive itself, it does kind of give a breakdown of what exactly an agent is and what they can do. To my knowledge, they would not be financially responsible. As I said, right through with Irizarry.
Right. I called legal aid because I was like, well, I better check this out before I keep telling people that you're not responsible. Because I have funeral homes call me and say I send over the medical power of attorney a lot of times to funeral homes. So then people panic again, like, oh no, the name and numbers on that. So and I guess when I just talked about Murphy the other day, they said, no, we just have to go, if there's no one to cover the cost, we have to call the coroner, even though the person is not hospital.
You just have to do due diligence to figure out who the next person is. Yeah. And because once the person dies, the whole advance directive is known.
Yeah, exactly. And maybe they're asking for the advance directive because typically that agent is going to be a family member, like a sibling or it's a child, something like that. So that would be my old guess. But yeah, that's
and actually with that as an extension, so with the advanced directive, say a power of attorney, it just, from my understanding, it just means that they're allowed to be able to make those decisions on behalf in those circumstances, not necessarily that they even must, right? Like, say sister is in that circumstance, all of the parameters, like this is her moment where she is given the opportunity. She could decide technically to say, you know what, I can't, I have to leave this to, say, the doctor or whatever. It doesn't necessarily commit them to making that correct.
Right. And so that kind of a two-part, I would say. As that individual making the advance directive, I mentioned earlier that the last thing you want to do is go to a hospital and find out you're a primary healthcare agent. So kind of that responsibility, if you're going to put somebody down on paper, talk to them and not just say, hey, can I do this? Can I put you down as the healthcare agent? I say, this is what the responsibilities include, and are you able to do this? Do you think you would be able to, whether you disagree with my decision or not, are you going to be able to stand up there and say, they said, don't resuscitate. What are you guys doing? No, for sure. That's good.
What is the process of us getting signed up as healthcare providers to get to access this?
So it's as simple as just shooting me an email. So in these brochures, on the backside, there's an email address. It's IHDR at DHW. I don't know about that up here also. So it's our general email inbox, but it's one that I manage. So you're essentially emailing me too. Or again, I do have some cards I can hand you. And for a facility, for example, Terry Riley, they send me a list of 50 names. I thought it's going to take me forever to fill all these out. So I actually designated one of them as an administrator and then let them create all the other 49 accounts. So for, I don't mind creating accounts for 10 people or so, but any more than that, there's other things that I should be doing. But yeah, just shoot me an email. I have a form that, it's, again, very generic. It just asks for that individual's name, their position, and then their email address.
Yes. Got a question. It's not complicated. It gets more selfish than that, you think. I want to get a CEU out of this.
Oh, I'm sorry? No, I'm not. So that's actually something I think Chance asked me about it, and I sent it up the chain to see how we turn this into a presentation with CEUs available. So right now, it's nothing, but hopefully that changes.
Shoot, is that we're gonna leave right now?
I know, right? No, it's getting a lot of stones.
So is there a nurse in the room that can offer some color to some hard questions?
I'm master of all rather all. I don't know if the Bureau of Occupational Licenses hit the veering off it. Then the efforts that were just 2 minutes. Science senior use because this is very productive.
Software. No, absolutely. And one thing that I kind of forgot early on was that advanced directives, literally for everybody, the age of 18 and above. So,
Well, that's directives have to be signed by Dr. Danelli or right or not.
no, not as I don't.
If they're right.
And Chris, they don't even need to be notarized, correct?
Right. Yeah, that's what she just said. So,
Okay, sorry.
As long as they're competent to sign.
yeah. So when I, again, first started all of this 4 years ago, I had my daughters complete advanced directives. And they're like, why? We're in our 20s. Why should we do that? And it just comes down to, I know how I would act in a situation that doesn't exist. But if something were to happen to them, maybe they're in a vegetative state. I do want to keep them around a lot longer and see what happens and extend their life because of my own selfishness. I don't know. So I have them, make those decisions. This is about you, not me. So I say 18 and above, you just never know what could happen.
Well, it takes the artificial out of families as well. They've got some that they do prior to when there is sound and eye shaking, they make all those decisions, and then that takes hands like about assemblies that, some may say, yeah, it's okay for us to win, don't, right? The other hack saying no, or for whatever reason they want to. It takes that decisions.
Oh, absolutely. That was so. Across the street, I spoke with some healthcare professionals earlier, and I shared my own personal experience where my mother had an aneurysm. She was taken to. She didn't have a first one, didn't want one. Taken to the hospital, and and had a do not resuscitate. And so it's explained for VA, it was explained to my family what that it's not just, they're not going to do CPR on her. It's, she has IV tubes and they're going to remove those. So when you're working with your patients or thinking about yourself, what if, you really want to get down to some of those levels?
What does that actually mean, do not resuscitate? So what you're actually filling out, for sure.
And the post out likes that as well. So that whether you want aggressive or comfort or yeah, it's yours.
And I'll go back. Again, across the way, somebody had asked about the post form where, they had an individual that didn't want CPR, they wanted CPR but didn't want ventilation. And so she's like, well, how would we do this on that form? And so obviously you can, so it can get a little confusing, right? Where it says, yes, CPR, attempt resuscitation, including mechanical ventilation. Well, what if you don't want that? So there is a spot in here, again, where you can kind of specify some of that, where, yes, you want the CPR, you're okay with that, but you don't want ventilation. You don't want the blood products or antibiotics, whatever it needs. Yeah.
Is this a pretty updated form? I mean, this is new. That looks different than.
So I'll say it's about 3 years old, give or take. Really old copies. Yeah. 2019. What is this? Yeah. So this actual one that you're looking at, that one is old. And there's even older ones than that. But so the one that we have available now, I updated. It's just a few years ago. Just little things here and there.
So you take feedback from professional on things as it. So you are a part of dictating how the post form is adjusted and some of these things as you get feedback like, hey, this is confusing. So they can give feedback too, like, what's in the world?
Oh, for sure. Yeah, and I absolutely welcome that with not just the post form, but the advanced directive, because we're just trying to make a product that is kind of generic enough that it's going to fit probably 90% of the patient's use. There's always some of those special situations, but the advanced directive, I just took a paragraph out of it a few months ago because it's very confusing. It talks about, either way you're going to pass, but in this situation, it's going to happen faster than this situation. And so it just gets a little confusing, a little muddled, and I thought we'll just take it out. With the Idaho statute, all that's required is a name, address, phone number, and a signature. Anything else in there is up to you. So we just, the registration form is even, this is pretty fancy. So this registration form, and I know it's just a very simple form, and especially what it's supposed to do, but I've probably updated that 10 or 15 times, I feel like. Just the more we learn, the more we know, like, oh, we don't need this, we don't need this. So why confuse people? Just get rid of it. They used to talk about a state filing ID number, and if we don't need this if somebody wants to just, maybe somebody's moving and wants to have their directive revoked. Just call us and let us know. We'll pull it. That's perfectly fine. So we don't need another document that was asking for that. So, yeah, again, anything you guys can provide is based on personal experience, professional experience. Yeah.
Can I ask? So how do you choose EMTs know that someone has a post form if it's not uploaded to the registry? I'm from Arizona, and they always printed it on a bright orange piece of paper that they would keep on the refrigerator, and then you tell them keep it on the fridge so that EMTs have access to it. But I haven't, when it's white, and always
right.
They heavily know.
Yeah, and so there's a couple of hospitals I've actually seen like a neon yellow or a bright orange form, which make great for scanning. So I've spoken with a few paramedics in the Treasure Valley at least, and when they go through their education, they're told one person is assessing the patient. The other was taking a quick look around the room to see if there is a post-scoring sticking out. And I actually think it may have been Arizona that used to do a purple tube project. Kind of got to go off track, but it's a purple tube that you put your post form in there and stick it in the freezer. And so paramedics knew to check the freezer real quick and see if there was purple tube.
So that's my question. It's not be at the same. Go. Not to sound critical, but so what? 2 questions. Why would I want this as opposed to just give this to my family and clients? And 2, how do you keep it updated? Because that's what sparked that is we've had the medication lists, the post forms, and things like that. Those get changed like all the time. So how do you keep it updated? And how would somebody even know if this was updated? You just kind of assume, and then and then it goes back to why would you want this? Where these things change so much. I mean, I deal with a lot of people. It's like this sibling is here, and so they get mom to sign this. The sibling from Michigan comes, and they don't like the way this is done, so they change it, and it gets updated. And you have a million different forms. You don't even know which one was accurate, right? So how do you keep that updated?
So that is the hard part, right? Kind of the big picture is the registry would be used as like that central location, right? But we know there's a lot of gaps to bridge to ensure that hospitals have the most current version. It does come down to the family or that individual, ensuring that what they have is the most current. Because he told a story about an individual that he filled an advanced directive out with his son. Here's an attorney. As soon as his son left, he filled a new one out and said, "This is the actual one that I want, because my son is pushing for resuscitate. I don't want it." So yeah, it is tough, but.
So you're saying basically in the ideal world, everybody has access to we could just pull that up and go, bam, here's ideally when everything is working the way you probably want it to. That's what the benefit would be.
Right. And, excuse me, one of the other pieces that we're working on here is working with the EMS dispatch, right? So if EMS does get hurt, dispatch receives a call that is unconscious individual at their home, they can quickly check the registry and say, oh, this person has a do not resuscitate. We have that form on file, so they can radio into the paramedics. Because I know paramedics aren't going to have the time to, on their phone, search for that individual to see if it's on there. So we're just trying to find little ways to close those gaps here and there. We even said, in the most perfect world, be on the back of your driver's license, right? Just scan it, and there you go. Arc little mech in there. And then we get into microchips out of the skin, and they could go down the route for sure.
Keep no-kids person. Is it just name and date of birth? Because what if they have, I can tell you there are 15,000 Melissa Liliash. I Google myself. I am all over the place. So it's very common days. So I'm just wondering, how does it work?
So I wish I had included that slide, because I do have a couple of slides that provides a little bit about the how-to, right? How to search for somebody. And 99% of the time, it is as simple as just their name and date of birth. That most often than not, because there are a lot of Kelly Johnsons, whatever the name may be. And if they coincidentally have the same birth date, we could look at social security number, the last 4. So on the registration form, there's a spot that some people will put their last 4 in there.
So how long does it take typically to search it? It's like if you're an ambulance driver, you call your people,
I know I might be a little biased because I've done this once or twice, but I can log in as I generally, when I'm searching for somebody, I don't even search for their whole name. So for myself, Chris Irizarry, I would just do CHR and then IRI. And because maybe it's spelled incorrectly by accident somewhere, because there's always that human error. that's enough to generate a search, and it's very quick. And then I can look. All right, here's 2. Well, I know his date of birth is this, so but it can go. So theoretically, it could be done as EMS is moving to a location, but I also don't know what a day in the life looks like for a paramedic. So, yeah.
So, just because I know most people in this room, most of them are very busy, what I would recommend, if you have to leave at 3 o'clock, obviously grab some of the paperwork and grab his card, and then he'll be a great resource going forward. But if you want to stay and talk with Chris afterwards while we clean up, you're welcome to do that. Does anybody have any other major pressing questions before we'll do some raffle winners, and then we'll close it, so keep them up for like and stuck, because I know some of you may need to go see clients. So does anybody have any major pressing questions?
Maybe one more interested person is pregnant. The post is null.
No. So I'm actually glad you brought that up, and I didn't show it here, but there is a statement in, I should say the post, the advanced directive, that does bring up a good question that I didn't write down. How does that affect the post? But it does say in there that if you're found to be pregnant at the time that an advanced directive takes place, prior to this, a doctor could keep that individual on life support until that child matures and can be born. But now there was a whole lawsuit, and so they took this pregnancy option and changed it. And they said, you have the option if you're found to be pregnant, you can either adhere to what you said. If that's do not resuscitate, it's do not resuscitate. And it's not the doctors per se, so it all came out like, well, it's still my right. You can't. Yeah, the whole big issue that came about. So I feel the law calls for men that promised that they weren't going to get pregnant. So it's very interesting. Yes.
There's a question on that. Is that state to state or is that federal? Just to know if it applies to our state or not.
I know it's Idaho. That's I'm kind of curious if that is something. Is it? Yeah. Which makes sense. But I just know there was a lawsuit that took place in between all this, so I got hands a lawsuit and a registry, and right, well, that's about it. So, yeah, always an adventure. But no, it does raise that good question, which is that I was at 5 or Fosequani. So, you did. I found a way to stop me. So, it's great.
To go back to the drawing board and that cost.
That's right. I don't even want to theorize what the answer could be. So, because it could go either way. Yeah, fine.
Awesome. We'll, Chris, let's give him a round of applause.